Good afternoon, everyone. iTech India welcomes all the participants for today's National Distance Learning Seminar. Today's topic is nutritional counseling among PLHIV, CLHIV, and ANC, and the speaker is Dr. Praveen Kumar. Dr. Praveen Kumar, sir, is the Director Professor, Department of Pediatrics, and the Deputy Program Director for Pediatric Center of Excellence at Kalavati Saran Children's Hospital, that's KSCH, New Delhi. He is also a technical group member for Government of India on nutrition programs. We welcome you, sir, for today's session. Uh, any questions? The participants are requested to please type in the chat box for now. All the questions will be taken up at the end of the session. So can we quickly run the pre-test, please? So, so can we please go ahead with the pre-test? Yeah, the pre-test questionnaire is now visible on your screen. You're requested to please scroll through the questions and answer them. All the participants are requested to scroll through the questions and answer the questions. The first question is asymptomatic PLHIV has energy requirements. Your options are 10% less as compared to normal adult, same as of normal adult, 10% higher as compared to normal adult, and 20 to 30% higher than normal adults. Second question is if a PLHIV has a BMI of 18.7, his or her nutritional status will be classified as normal, underweight, severe thinness, overweight. Third question, which of the following statements is not correct? The options are the protein requirements for PLHIV are not different from those infected with HIV, that is 1 gram per kilogram per day. About 20 to 30% of the total energy should be provided by fat. PLHIV should take 8 to 10 glasses of water per day. Energy requirement of HIV positive pregnant women as same as non-pregnant women. Fourth question, if a child has a weight for height less than minus 35 3 SD, his nutritional status will be classified as severely underweight, stunted, severe acute malnutrition, or wasting. Participants are requested to please take the e-poll. We have another 2 minutes for the pre-test. In case we have participants from SACS or COE, pCoE, requesting them to send the NDLS Zoom link on WhatsApp group of ART staff. We have already sent emails to everyone. You are requested to please send the link on WhatsApp group as well. Requesting all the participants to please take up the e-poll. Thank you to everyone. Kiran sir, we can end the e-poll now. Now I request sir to please start the session.
Right. Okay. So thank you so much for inviting me, and very good afternoon to all participants. So topic already has been introduced, and we all know that nutrition is one of the important component of our health. And to have a healthy life, we need good nutritional status also. So particularly the importance of nutrition, particularly for PLHIV and CLHIV, this is the one aspect of management which is often neglected. And we also know that malnutrition is common, which is contributed by several factors. And because HIV, this may lead to poor nutritional status, weight loss, muscle wasting, both macro and micronutrient deficiency, they may happen. We also know that these micronutrients, they play important role, and protein, all they play important role in having proper immunity. So when they have these deficiency, this leads to impaired immune system. And when they have impaired immune system, then they have poor ability to fight HIV and other infection. And when they have this impaired immune system, this will lead to increase, susceptibility to infection, increased frequency and duration of opportunistic infection when they acquire. And these infections will further increase their requirement. There may be hampering of absorption from intestine, which will increase increased requirement of nutrients. And many a times these patients also will have poor appetite, and ultimately we have a vicious cycle. And unless we take care of nutritional status, uh, the patient PLHIV or CLHIV will go in this vicious cycle. So if we are able to improve their nutritional status, then most of time this PLHIV and CLHIV people, they will remain active and productive. They will be able to maintain their nutritional status. They will have lesser illness, and they will recover more quickly when they have some infection. They will be able to maintain a good appetite, and they will have a stable weight, and they will also have improved quality of life. So that is what we all need, and we want our PLHIV and CLHIV to be. So what are the changes, and what are the causes of undernutrition? As I mentioned, these are multifactorial, because there is, due to increased breakdown of tissue, there is an increased energy requirement of PLHIV. And that's the reason, even in asymptomatic phase, the energy requirement increase is by 10%. So many of you answer correctly, but some of you mentioned same. So it's not there. The energy requirement increases even in asymptomatic by 10%. And when the intersymptomatic phase, when they have symptoms, then the energy requirement increases further, and this will be by 20 to 30% of the normal, of that normal age and gender. There is also an imbalance between pro-oxidants and antioxidants, leading to oxidative stress on the body. So ultimately, this leads to poor immunity. The same time, the PLHIV and CLHIV population, they also have reduced food intake, which again may be due to several causes. The first is they have inability to eat because of the oral lesions, like painful oral ulcers, or they may have oral thrusts in the mouth and throat. They may be having loss of appetite due to HIV infection per se, or maybe due to depression, changes in mental status. They have so much of mental stress. Many times they may have food insecurity and poverty, leading to poor access to food. Then we know they are predisposed to infection, and particularly certain opportunistic infection like tuberculosis will further add to loss of appetite. The diarrhea may be there, which will cause malabsorption. And many times we have several, ART drugs also. So many of them, they may cause some side effects, which is causing nausea, loss of appetite, altered taste in mouth, diarrhea, vomiting. Then we also know HIV positive patients, they usually have enteropathy, and that leads to reduce absorption of nutrients from the gastrointestinal tract, particularly in advanced stage. Diarrhea, when they develop diarrhea, because many of the persistent infection or drugs, they can cause diarrhea. So this will result in malabsorption, leading to water and nutrient losses from the body. And then there are certain medications that also interfere with nutrient absorption. Then changes in body composition. We all know in case of PLHIV, protein are used rather than fat to meet the energy demands many a times. And the protein are broken down while fat continues to accumulate. So they have these changes also happening in PLHIV many a times. So how to take care of nutrition? If we want to help a PLHIV or CLHIV so that they have good nutritional status. So for that, the first thing which we need to do will be nutritional assessment. And then when you do this nutritional assessment, you will have to decide whether nutritional status is normal, whether there is undernutrition, whether this is overnutrition. Then you will have to decide what intervention you need to do, whether you should praise the PLHIV or CLHIV for having or maintaining good nutritional status, or there is a need of some counseling or some changes in their food, nutrition intake or diet. So that is what we need to do. And then you will have also to see what is the impact of whatever intervention you have done, whether that is working or not. So the nutritional assessment helps us in planning appropriate nutritional intervention and counsel them. So what are the tools available which we have for nutritional assessment? You can remember easily this as A, B, C, D, which you can see on your screen. So A stands for anthropometric measurements. You will take certain measurement and that will tell you whether the nutritional status is normal or this is no undernutrition. Then B stands for biochemical assessment. You do certain investigations, lab investigations which you routinely do, like you can do serum protein, you can do HB, which will tell you that whether the child or the patient has some nutritional deficiency or not. Then the third is clinical assessment. We do clinical examination, like you look for anemia, you look for other signs of nutritional deficiency which they may have. And the fourth is dietary assessment, that you take their dietary intake in last 24 hours, or we also use food frequency questionnaire to identify the people where we need to counsel them for changes. So you can easily remember A, B, C, D. So I hope at least anthropometric measurement you must be doing whenever there is a patient coming to your ART center. I am sure you must be taking weight. But I do not know whether you try to see whether that weight is normal for his age or gender or not. If you are doing, it's very good. If you are not doing, you can start doing this, and that will be what we will like to achieve from this, whatever webinar which we have today. There are certain biochemical assessment which you are doing routinely as a part of your ART services, like HB. You may combine certain other aspects whenever there is a clinical indication. Clinical assessment you are doing, I do not know dietary assessment, but particularly whenever you have undernutrition or overnutrition, you should give some time for dietary assessment, because unless you have dietary assessment, you won't be able to advise them correctly what are the changes they will have to do in their intake. So what anthropometric measurement we are interested? Most of time you take weight, and whatever I have shown you, the weight may not be ideal. If you have a digital, then that will be preferred. But if you do not have, you can use this. But particularly for children, ideally we should have some digital weighing machine, so that we can also detect smaller fluctuations. Then for height measurement, we use this stadiometer, and that you should use to this. Then the next is that we classify. So how do we classify? For that, you should calculate their body mass index, BMI, which is weight in kg, and then height in meter and meter square. So that you do the calculation. And what you see, if the BMI calculated is between 18.5 to 24.99, then this is a healthy weight for that age and gender. If it is less than 18.5, we classify underweight, 17 to 18.49 mild thinness, 16 to 16.99 moderate thinness. But if it is less than 16, then this indicates severe thinness. Similarly, few of the patients, you may have overweight or obesity, which again, you can grade according to BMI. If this BMI is more than 25, then it's overweight, 25 to 29.9, then grade 1 obesity, and 30 to 39.9, grade 2 obesity. So in these cases, you may have to counsel them to increase physical activity, and you will have to tell them to modify their dietary intake. So biochemical assessment only when there is some clinical indication or as a part of ART services which you are doing, then you should do. Clinical assessment, we take their history, and we try to look for any clinical sign which indicates nutritional deficiency. In dietary assessment, we try to take type, frequency, and amount of food eaten, appetite, food habit, and eating behavior that you analyze, so that you can identify and help them wherever there is any changes required. So particularly the clinical assessment in PLHIV and CLHIV, there are certain things which are really important for and which are related to nutritional status. And these are history of dysphagia, or if they have problem in swallowing. This again indicates, because that will affect their nutrition. Then you try to look for oral thrush or any oral ulcer, because again that will hamper oral intake. Look for whether the child has fever, because child or patient has fever, anemia, vitamin deficiency signs, and clinical features of OI, especially tuberculosis. In dietary assessment, we try to see what are the types and amounts of food eaten, and most of time the factors affecting food intake you can identify, and you can take by 24 hours dietary recall in which you tell them to tell you what all they have taken or whatever they have consumed in last 24 hours. And the second is food propensity checklist, and that is important for assessing dietary diversity. So, because it's not necessary that everyone will take every food item daily. So to have idea whether the patient has good dietary diversity or not, you need to ask how frequently they take pulses, how frequently they take vegetables, fruits, how frequently they take milk and milk products or non-vegetarian food items. So that is what you will be able to have idea only when you ask what food frequency checklist. So now, once you have done this nutritional assessment, then the second step is that you should be able to have a nutritional diagnosis. And what we understand by this, that analyzing nutritional assessment data and arriving, because we may have either normal or maybe may have underweight, or we may have undesirable weight gain. So we will have to decide, and we will have to try to help that PLHIV or CLHIV to change their dietary pattern, or so that we are able to optimize over nutritional status, and we are able to empower them to take responsibility of his or her health. Once we have decided and we have implemented those interventions, then we will have to monitor the individual status at the scheduled follow-up visits regarding the nutritional diagnosis, intervention, and outcome. And then we have to compare with the previous status whether whatever desired changes which we are aiming, whether we are able to get or not. So coming to energy requirement, we have already discussed different component. We have already discussed that during the asymptomatic stage, energy needs are increased by 10%. And there is a 20 to 30% for total increase when they become symptomatic or they develop some opportunistic infection. So the recommended energy intake of PLHIV also apply to HIV-infected pregnant and lactating women. So the protein requirement, if we talk about protein requirement, they are not different from those not affected with HIV. It is approximately 1 gram per kg per day, which we have for normal population also. And how we can, wherever there is a need and when they have lesser intake, how we can improve it. We can improve by adding or advising, or you can counsel them to take the good, cheap and readily available sources of protein like eggs, milk. They can take besan products, soybean, which we have available in different parts, any type of dal, or if they are non-vegetarian, they can meat and meat products. That is what they can consume. When we talk about fat, then about 20 to 30% of the total energy ideally should be provided from fat. And at least 50% of fat should consist of vegetable oil rich in essential fatty acids. So you can tell them if you find this is not there, then and they need to increase the energy density of the food item, then you can advise them to add ghee, butter, or any edible oils which they use. Then at the same time, we all know that micronutrients, they are very important, particularly for immunity, our production of hormones, and the metabolism, because the micronutrients, they play important role they have in different metabolism. So a daily dose of micronutrients providing vitamins and minerals, you may have to supplement, particularly if there is dietary deficiency or they do not have a variety in food. So whenever there is lack of food diversity, then you should advise them to take supplements in form of supplements. And then for taking care of oxidative stress, one may use antioxidants. Then coming to one of the important component which now is being realized, that with changing time and with the change in our dietary pattern when we are moving towards from natural food to more ultra processed food, this dietary fiber is decreasing. So that if the patient has poor appetite, and they should consume fiber in less amount, because you want to give them energy density in that case. But at the same time, if the patient has some no constipation or some other problem like irritable bowel syndrome, then in those cases they should consume foods which are rich in fibers. And what are these food items? These are cucumber, apple, seasonal fruits, or flax seeds wherever it is available, or green leafy vegetables. So they can add to their daily diet to increase this. Coming to fluid requirements, it is almost same which a normal population or normal adult will have. 8 to 10 glasses of water they should take. But at the same time, whatever the water they are taking, this should be safe, and they should use safe water. And wherever there is any doubt, then they should boil water, or they should use filter tap water. Then coming to energy requirement during pregnancy, we all know the baby or fetus, which is there, also gets nutrition from the pregnant women, and that's the reason for optimal growth of that fetus, it's very important that a pregnant woman take additional food item which is able to provide them approximately 350 kilocalorie per day. There is also additional protein requirement, which again further increases in third trimester. And similarly, you can see there are additional requirement in fat, iron, calcium, iodine, vitamin A, vitamin C, and folate. It's very important. We know in our country, and particularly if there is HIV also positivity. So a well-nourished mother will give birth to a healthy child. Maternal diet during pregnancy will influence fetal growth, as I have mentioned, size and health of the newborn. So if there is a poor nutrition during pregnancy, that will further increase risk of complications such as prolonged labor or even death may happen. So we have to counsel them about these additional requirements which we have. We have to tell them to take extra snacks, or no good quality food item, so that these additional requirements are there. At the same time, as per our national program, there is provision of IFA supplementation, which they should start as per national guideline from second trimester. They also need to start calcium. They should take vitamin A rich food item. Vitamin C particularly is important for absorption of iron. So that should be done during pregnancy. So what is the overall, see, it's very, although I have mentioned, but it is very difficult for you to give individually that what food item they should take. And that's the reason we have to usually give a general approach, and we have to explain importance of well-balanced diet. And you can just give them some guidance so that there is good food diversity and there is healthy food items and protein rich. Whenever you feel there is one component which is causing imbalance in diet, then you can advise them to decrease that. So we try to tell them that there should importance of well-balanced diet, why it's important. Tell them to avoid fried, highly spiced, or strongly flavored food items, particularly for HIV because they are on ART and then that may precipitate nausea, vomiting. They should take small, frequent meals, which we can tell them because many a times at a time because of the poor appetite, they are not able to take full amount. Then we can tell them to take a small, frequent meals. We should advise them to use some good quality protein in form of milk, paneer, egg, chicken, wherever possible. We should advise them to use whole grains and not the ultra processed food items. They should consume green leafy vegetables that will help them to meet their vitamin and minerals requirement. They should prevent constipation by consuming 5 to 6 servings of fruits, vegetables daily. And they should use raw fruits. Many a times, what you will realize, many of people, they usually take juices in place of, or they use Tetra Pak. That's not good because there is very high osmolarity. They are not meeting the requirement. So in place of juices, you tell them to consume whole fruit rather than just use juice, because uh, the fiber which they should consume, that will be made by only when they consume whole food. They should also stay hydrated with plenty of water, and they should ensure a rich diet in calcium and iron. As I have mentioned, they should take supplements as which we have in our national guideline. Then coming to nutritional requirement, particularly during lactation, it was additional 350 during pregnancy. Now you see this is additional 600 kilocalorie when the mother has a baby is 0 to 6 months. And there is an additional 520 kilocalorie requirement for 6 to 12 months when the mother is breastfeeding her baby. Lactating women, they also need some additional protein, particularly 17 grams per day, additional 13 gram per day, 6 to 12 months. Fat is also 30 grams per day. Iron, calcium requirement is there, and that's the reason they should continue iron, IFA, and calcium supplementation as per national guidelines. So during lactation, many a times, because of our misbeliefs and many a times, many of the food items they don't consume, but you can just tell them that as per evidence, no food are strictly restricted during pregnancy or lactation. There should increase intake. There should be increased intake of fruits during lactation. They should avoid highly spiced or strongly flavored foods, as we have mentioned previously also. Small frequent meals may have help when particularly they have poor appetite. And there are, although it is not very no evidence based, but there are many food items which are believed to increase milk production, and those things, if they are taking, you can tell them to continue. Now coming to types of infant feeding, and just to before I discuss what are the feeding recommendation. So we say exclusive breastfeeding when the baby is being fed with only breast milk. The baby is not given any food, fluid, or water. However, drops or syrups consisting of vitamin, mineral supplements, medicine, or vaccines, that is permitted. So if there is a medical indication, medically indicated vitamins, mineral supplementation, That is allowed. Even if the baby is taking, you will classify them as exclusively breastfed. While exclusive replacement feeding, which we had previously, now as per current guideline, I will tell you what is recommended. But in these cases, there is no breastfeeding at all, and the baby will be fed either animal or dairy milk or infant formula. The ideally, we will need to have hygienic preparation of these food items, and they should feed this by katori spoon and not bottle feed. While there is another group where this is mixed feeding, where we say breastfeeding plus other food or fluids such as animal or formula during first 6 months of life. If the baby is getting breastfeeds also and some other feed also, so milk, other milk in form of animal or formula, then you say this is mixed feeding. So what is our current guideline, national guideline regarding feeding of HIV exposed or infected infants less than 6 months of age? Please remember there is a lot of change in feeding guideline in recent few years. And as per emerging evidence, exclusive breastfeeding during first 6 months of life is now recommended along with ART prophylaxis to the baby and ART to the mother. So if the mother is compliant, you can tell them to continue exclusive breastfeeding, no, and you will advise ART prophylaxis to the baby. In a situation where the mother is practicing mixed feeding, healthcare worker and counselor should motivate her to exclusively breastfeed because there is a small risk, but there is a risk of increased transmission when they have mixed feeding. When exclusive breastfeeding is not possible for any reason, like their mother has expired, sickness, or there are other problem, then the health worker can be reassured that the maternal ART reduces the risk of postnatal HIV transmission in the context of mixed feeding as well. So many a times, if suppose like this will apply for twins, or the mother feels she is not able to have enough milk production and she has to supplement. But if she is taking ART and has good adherence to ART, then now as per current evidence, the risk of transmission is negligible and this is not significant. Then the third point which you should remember is the mother known to be HIV infected and whose infant are HIV uninfected or unknown HIV status, they should also exclusively breastfeed their infant for first 6 months of life. And then they should introduce complementary feeding and continue breastfeeding. Because not breastfeeding has, they are linked with a lot of morbidity and increased risk of mortality. So they will be able to protect this by this. And breastfeeding should only stop once a nutritionally adequate and safe diet without breast milk can be provided. So mother should ideally must breastfeed for at least 12 months. If they want, they can continue breastfeeding for up to 24 months or beyond. So they should stop breastfeeding only when there is adequate complementary feeding is introduced. But at the same time, you will have to highlight the importance of good ART adherence in these mothers. Then exclusive replacement feeding is only when situation of breastfeeding cannot be done or when the mother insists that they do not want to take and they want to go for that. But at the same time, you also try to see whether they will be able to meet all 6 criteria for replacement feeding when we are doing. So why there is so much of stress that we all should advise mother to continue breastfeeding or exclusively breastfeed? Because breast milk is tailor-made for the baby. This breast milk has anti-infective properties which protects them from infection. This is a source of natural immunity. There is also anti-allergic properties, so eczema, urticaria, that will be prevented. It is economical because if they give animal milk or formula, that will put some extra stress on them. There is a psychological advantages because bonding will be more, and this also has some contraceptive effect. So once you have given 6 months of exclusive breastfeeding, now baby has completed 6 months, then you will have to introduce some food item, which we say complementary feeding, along with breast milk. And why so? Because the only breast milk is not going to meet the whole requirement which the baby has. And then you also have to tell them that whatever food item they are giving, this should be having appropriate consistency like this, which you can see here, just write whatever is there. So like this, they should, and when they tilt the spoon, this should form like the shape should be like a tongue. When they tilt, and if the consistency is like that, it is running from a spoon, this is too thin. Or if it is not at all, then also the child will not. If you are giving too thick, then that also the child will not be able to, because so far the baby was consuming only milk. So initially we have to give them food item which is soft and consistency is like this, which is shown here. Then also we have to remember they have limited stomach size. So if you give them too thin, so what will happen? Whatever water you have used to prepare this, the stomach will be filled with that water and the baby's requirement will not be fulfilled. So how much amount they should give? At 6 months, if the baby is breastfed 2 times per day plus frequent breastfeed, 2 to 3, they will start with 2 to 3 tablespoons, and gradually this will be increased to 2/3 of the katori or bowl. Then 9 to 11 months, 3/4 katori, and 12 months, 1 full katori. Initially 2 times per day, then 3 times, 3 meals plus 1 snack when they are 9 to 11 months, and 12 to 24 months, 3 meals plus 2 snacks. So that is the amount they should give. So now I have also asked you to assess food frequency. So basically the food frequency questionnaire is to decide whether there is good diversity or not. So why we need? Because every food item has their own purpose. So when we use cereals, that will give us energy. Then green leafy vegetables, they are important for vitamins and minerals. Fruits also. Then when we use this in energy enhancing food item, that is for improving the quality of the food item like energy density, and then particularly the animal origin food item for quality of protein. So we have to assess whether the child is consuming or the PLHIV is consuming all the food items or not. When you have a child or a person who has undernutrition, then you can counsel them to enhance the nutritional value of food by, so maybe in place of water, they can use milk to prepare porridge. They can add jaggery, butter, ghee, while to improve the energy density. They can use a sprout of various pulses and they can prepare this baby's feed. They can roast peanuts, make powder, and add in whatever food item they are giving. So that's how they can enhance. So I have already discussed how to assess nutritional status of PLHIV, but now few words about anthropometric assessment in children. So weight and height we have already mentioned, but if the child is less than 2 years, you will have to take length. We also measure mid upper arm circumference, and then once we take these measurements, we have to compare these measurements to reference standard and cutoffs, and then we have to decide whether it is normally or not. So as per our guideline, the weight should be taken when every visit to ART center. Length we have to take for children who are less than 2 years of age every 3 months. Height you have to measure every 3 months for the babies who are 2 to 5 years, and then after 5 years every 6 months, and then mid upper arm circumference. So believe me, when you take these anthropometric measurements, and that will tell you a lot of things. No, before the child will fail on ART, and many times whenever we have the SASAP meeting, we try to analyze what are the growth parameters, where the baby is growing normally or not. And whenever there is compromise in growth parameter, we are alerted, no, there is something which is not right and there is problem. So once you take these, then you plot on a growth chart, and when your measurement is lying between -2 SD to +2 SD, then this is normal. The median is this. And when you have deviation, or when it is below -2 to -3, then this is moderately underweight. When it is below -3, then this is severely underweight. Similarly, we have this is a gender waist. So weight for age for boys, weight for age for girls, that you have use. And for older children, we have IAP BMI charts. You can plot and you can determine, that will tell you the Indian cutoffs, and you can determine their nutritional status. So what is the WHO classification? This is the classification which, whenever our measurement is between median to -2 or +2, then we say this is normal. When it is lying between -2 to -3, then if you have taken height, then the classification will be stunted. If weight for age, then underweight, weight for length, then wasted. If it is less than -3 SD, then severely stunted, severely underweight, and severely wasted. That is how we classify their nutritional status. So a lot of information we are getting when you will plot them at different time points. And a normally growing child will not have a smooth line. You may have some ups and downs, but this will be going up. So a growing whale child, you will have like this. But when there is a flattening, it is a static, then you be alerted. There is some problem in the child. And when there is decline, then this is definitely a problem. So weight for age will tell you that the child is underweight or severely underweight. But please remember, this may happen because of acute malnutrition or chronic malnutrition both. While length for age will give you stunting, severely stunting. And when we use weight for length or height, this will tell us whether the child is wasted or severely wasted. Wasted mid upper arm circumference, we use this in less than 5 years. And many a times this is more useful when you are not able to take height, like bedridden, they are not able to stand. More than 5 years, you will be using BMI. So you have a classification, like if the child has visible severe wasting, edema, or more than 5 years if they have BMI is less than -3, then we classify severe dehydration, severe malnutrition, sorry. Then if there is a reported weight loss, very low weight or underweight, then you classify poor weight gain. If the child is growing appropriately, then you classify, or if the child has some infection where requirements are more, then you will classify as conditions with increased nutritional needs. So how do we manage? Usually the feeding guidelines for HIV infected infants and children are same as those for healthy children. Apart from, we will have to tell them to increase energy needs. And if the mother is confirmed to HIV infected, then they should be strongly encouraged to breastfeed exclusively, but same time with the good ART adherence. Complementary foods are introduced at 6 months of age in these age group also, these CLHIV also. And the quantity and frequency of food is increased as the child grows older, as I have shown you. And the food consistency is also gradually made thicker and variety is introduced adapting to child's requirement. So all children need adequate nutrition for growth. So that should be there. And particularly when they have some opportunistic infection and particularly other chronic condition like tuberculosis, then their metabolic demand even is more as compared to this. So how much? This is the broad guideline which you have already there in 2021 guideline. You can refer this whenever you have a child. So for different age, if it is the requirement which is for uninfected, if this is asymptomatic, then 10% increase. If there is a symptomatic, 20% increase. And if it is a severely malnourished, then we have to manage them as per our SAM guideline. So how to increase energy intake? That they can do by adding some edible oil or uh, fortifying this, then some increasing some energy containing food items like adding banana, 1 cup of milk, or maybe one sweetened curd, or one extra roti. So you will have to use whatever is looking feasible for your patient, and accordingly you can advise them to increase this. For different age, this is already there in your guideline. So what I'm just, because you will not remember, you should ideally refer to these recommendation for advising them. For growing well and asymptomatic, as I have mentioned, this is there. And when they have some opportunistic infection, then further increase in the requirement. What are the supportive measures? Ensure adequate micronutrient intake as per by in food diversity. Or if that is not there, then you should give them supplements. As per our national guideline, they should receive vitamin A dose every 6 monthly, so that should be given. Deworming every 6 months, then cotrimoxazole prophylaxis, which you are giving. When the patient has diarrhea, you give zinc as per national guideline, we have to give for 2 weeks. And also encourage, this is very important for improving their appetite. They should be engaged in regular play and appropriate activity and timely immunization. When they have some sickness, it's very important to maintain their nutritional status. And for that, we have to feed a small amount more frequently, be more patient, give them food that the child likes, and variety of food item that we have to use. Then nutritional care during illness, that we have to advise them to add milk, curd, and enhance the energy density, particularly during illness. When they recover, then whatever there is nutritional compromise, that we have to take care by feeding extra meal, extra amount, and with extra patience, and you can tell the mother to give some extra breastfeed. Food safety is very important because they are prone for infection. So we have to tell them importance of maintaining hygiene during preparation, keeping food at safe temperature, and using safe water. So I think that was all regarding how they can maintain. So I think this is time for post-test. So over to team for post-test. Over to you, Sweta.
Thank you so much, sir, for the wonderful session. We'll quickly run. I think we'll take the questions from the chat box, sir.
Yeah, please.
And then they have the post-test.
Right.
Give me 2 minutes, sir.
Oh,
I'll just take
I
the
see
question.
only one question. Do you see any other?
It's regarding whether asymptomatic stable PLHIV needs protein supplement intake.
Okay, right. So as I have mentioned, see the protein requirement is same, and I have given you. So if they are able to take or increase and take good quality protein, which I have already given you, so then there is no need to give supplements, right? So supplement is needed only when the child or PLHIV has very poor appetite, there is increased protein requirement, and he is not able to meet. But always try to understand, when you are giving supplement, you will be giving only one component. But when you are trying to meet with the food diversity and changes in food consumption, then you will be able to meet their micronutrient and other component also. So always prefer to manage with increase balanced diet and changing the food diversity, because supplementation may be only for the time being. This may not be permanent solution. Over.
So there's another question. Is it advisable for PLHIV with diarrhea to take fruits and fiber-rich food?
Right. So see, we have to remember, see what we want. When the child has or PLHIV has diarrhea, you have to first try to identify what is the cause of this diarrhea. And in diarrhea, the most important thing is the maintaining hydration, right? So you have to see, and changes are only when fruits, or if they are taking too much of juices, then you have to tell them to decrease because of osmolarity, because that may be causing diarrhea. But otherwise, as per recommendation, only when we have to tell them to decrease. Otherwise, the normal amount or whatever is the recommended fruits or fiber, that is recommended. Only when it is causing excessive amount is there, then you have to tell them to decrease. Otherwise, you have to just tell them to increase the liquids rather than fruits. Over.
There's one more question. Do you think that there is a need to capacitate the ARTC staff on ABCD of nutritional assessment, as the position of nutritionist was limited to COE, pCoE, and the position is no more available now?
Right. So I think, see, this is something which nutritional assessment and nutritional care is critical, right? Who is doing, that is a separate issue. Whether we need a nutritionist or whether this will be done by counselor or other ART staff, that's a different question. But someone will have to do, that is sure.
Thank you, sir. Any more questions? Participants are requested to please unmute their mic.
No, I think so the last question. Hello, sir. Who should take? Everyone should take. It is duty of doctors also, and nutrition, the counselor who are posted there. Everyone should take care. See, why we have to provide the integrated care, and then we have to give this. So even doctors, they are responsible. We can't say only one person is available. As a doctor's medical officer, also we have to give information which are related to nutritional counseling. Even counselors, they have to identify the people with poor nutritional status, and they have to help them in improving their dietary intake.
So next question is about what nutritional advice should be given to obese women living with HIV.
So you have to tell them that they should increase their physical activity and they should change their dietary pattern. If there is too much of fat consumption, that you have to advise. But the main major factor which we see most of time at present time is because of the decreased physical activity. So you will have to tell them to increase physical activity. Uh, that is the main message which should be given.
So the next question, what should be
I
the
have already
okay.
given this 20 to 30% which should be there.
Right. Uh, what are the other nutritional interventions that can be suggested for Indian HIV scenarios or at the ART centers?
What nutritional interventions can you suggest? So see, the nutritional intervention, the basic thing is that we should have diet, which I have already shown you, and then there should be good dietary diversity. What is the problem is there is too much of consumption of ultra processed food item, which you should identify, tell them to decrease, and they should consume and they should increase food diversity. That is the key message which I would like to give.
Any more questions? Participants are requested to please unmute their mic. Please feel free to type in the chat box as well. Any special considerations for comorbid conditions?
So the comorbid condition, you all already have to follow disease-specific guideline, right? If it is what condition I have, and we have to appropriately address those items.
Yeah, we'll just continue for another 2 minutes. Any questions? Please feel free to unmute your mic. So I don't think there are any questions. Can we please go ahead with the post-test?
Yeah. Sweta, can I log out because I have to go?
Thank you so much, sir.
Okay,
Thank you so much for giving us time, sir.
Thank you.
Thank you, sir. Yeah, participants are requested to please take the post-test. The questions are visible on your screen. Please scroll through all the 4 questions and answer them. Requesting all the participants to please attempt the post-test. Screen sharing has been stopped. That's the reason nothing is visible on your screen. Hope you can see the post-test. No. Okay. There must be some technical issue. Sorry about that. I'll read the answers after the post-test. Thank you everyone for attempting the post-test. Kiran sir, we can end the e-poll now. Some technical problem, I'm unable to share my screen. I'll just read out the answers. The post-test questions. First question, asymptomatic PLHIV has energy requirements. The answer is 10% higher as compared to normal adult. Second question, if a PLHIV has a BMI of 18.7, his or her nutritional status will be classified as normal. That's the answer. Which of the following statements is not correct? So there were some statements given and we had to choose which is incorrect. So the statement energy requirement of HIV positive pregnant women are same as non-pregnant women. This was the incorrect statement. Fourth question, if a child has weight for height less than -3 sg, his nutritional status will be classified as, the answer is severe acute malnutrition. I thank all the participants for participating in this session and for patient listening. In case you have any questions, please feel free to write back to us at dlsinfo@itecindia.org. Thank you. We'll conclude this session now.